Dr. Sean Paul, straight out of surgery, to talk with me today. Great to see you. Thank you for joining me.
Thanks, Leslie. Happy to be here.
You are not only an oculofacial plastic surgeon, but you are the creator of something brand new called ideaAUSTIN. And that is something that everyone can take part in, not just folks in Austin, right?
Correct. So ideaAUSTIN has been an amazing event that I've been working on for the past year. Initially, we were supposed to have the event as a live in-person event during South by Southwest. And obviously, with all the things that have changed in the world, we've decided to take the event virtual. It'll be on August 8th. And we're so lucky to have partnered with the Central Texas Food Bank to help those who are in need, particularly children and veterans and family who have fallen hard times and need our help. And so it's an event that's primarily a summit on aesthetics, innovation, and design. And the idea actually stands for innovation, design, entrepreneurship, and aesthetics. And so you're going to get to hear from some of the world's experts on the newest technologies in aesthetic medicine, as well as amazing people in design, such as Ferrari, as well as motivational speakers and Olympic gold medalists like Sonia Richards-Ross. So you're going to hear a great collection of speakers. It's really a time for people from different backgrounds to come together and learn. We're primarily having people in the medical aesthetics world targeted toward the event, so we want them to come and listen and learn. But it's open to the general public, and most importantly, we want you to support the Central Texas Food Bank.
And let's talk a little bit more about that, because something that's very important to you. I know you had this plan when we were in different times, and now your focus has really become one of philanthropy.
Yeah, I think, South by Southwest really brought an environment for a blending of minds and thoughts and energies. And then when the wind got sucked out of everyone with that cancellation, plus then coronavirus really kind of shutting down a lot of the economy and businesses around, particularly being a physician and having to work in the hospital during these times and care for patients, and also work with colleagues who are on the front lines and dealing with businesses and friends who've lost their jobs. I just really thought it was important to shift gears and focus on those who needed help. I really don't think that anyone should go without food. And so I think it's critically important that we can find a way to come together. So what we've decided to do is we have a free event that you can tune into, but we do have the ability for you to donate during the registration, and 100% of all the proceeds will go directly to the Central Texas Food Bank.
Which I think is amazing and very generous on your part and all of the panelists' part and the sponsors' part. Everyone really pivoted and decided, you know what, this is what we want to do.
Yeah, sometimes there's just things that are more important than, what you initially thought was important. And so I think for us to look at the greater good for our community. So as a Texan born and bred, I think it's really important to look at those people around you and understand that you can really make a difference. We have amazing speakers who are physicians, who are in the industry. We also have local businesses as well that have joined us as well to work with us. So I think we all just want to help whatever we can do.
And it's going to be amazing as far as the information that someone like me or someone who is actually in aesthetic medicine to listen and learn. And really, you can be anywhere now and be a part of this now that it's gone virtual.
Yeah, all you have to do is go to ideaAUSTIN.co or ideaAUSTIN.com, and you can register directly there. You'll be sent a link, and you can actually tune in and watch live during the day on August 8th. So it starts at 10 a.m. Central. And you're going to hear on amazing topics such as meditation and wellness. You're going to hear doctors walk you through how to meditate if you're feeling stressed out. You're also going to hear about the different things that are new in aesthetic treatments, whether it comes to jawline contouring, double chin, lip augmentations. You're going to hear some pretty fun and interesting things as well. We're also going to have some amazing speakers such as Dr. Michelle Henry, who's a University of Texas alum and a dermatologist based out of New York City, really talk about just how to start a skincare routine, how to kind of focus on self-care, because there's so many things that we've all forgotten about, whether it's, simply just getting your hair done or taking care of your nails or going to the, kind of doing a normal outing. And so, skincare, especially if you're stressed out, it's an important thing to focus on. And it's also summertime, so we're trying to spend as much time outdoors and how to protect your skin from sun damage.
And also, I understand there is going to be something especially for women who are interested in rejuvenation of their health and a lot of, they're going to get their questions answered that maybe they're too embarrassed to ask. And it'll all be done for the viewers from the privacy of their home.
Yeah, we're really, really pleased and lucky to have Dr. Camille Cash from Houston and Dr. Jennifer Owen from Lubbock. They're the world's experts in women's sexual health treatments. So a lot of patients that come to them, whether they have had children or not had children, don't know how to approach that topic when it comes to sexual health and options that they have. They partnered with InMode Aesthetics to develop some amazing treatments that can improve sexual wellness. So it's going to be an amazing topic. The best part about this event is when you log in, you can ask questions during the event and not feel like you have to schedule a formal consultation and get the information maybe you've always thought about but not known how to ask.
And let's talk about some of the other information that people will be able to learn about. Things like the new Fountain of Youth. There's so many options now out there. Doesn't necessarily mean you go and have surgery.
Correct. So we have Dr. Chris Jimenez, who's an orthopedic surgeon in the Austin area. He's going to be talking about the way regenerative medicine, or biologics, or what they're called, which is kind of using your body's own natural growth factors to improve things like arthritis, as well as ways to improve cartilage around the knee. Those are things that are really important in functional health as well as aesthetic health. So we have some of the world's experts in hair, such as John Frederick from Beverly Hills and Dr. Deborah Shom from India, who are going to come and speak about the way they approach hair loss or they approach other aesthetic areas by using regenerative medicine. So it seems like the common theme throughout this is less and less surgery, more and more new innovation. And all the speakers that are coming in and speaking to us have done research. They're experts on these different treatments. They use them with their patients. They can kind of give sort of a raw, unadulterated view of these different treatments and tell you what works and doesn't work.
And they also get to hear from you, who is not only an international speaker, you're an authority in oculofacial plastic surgery, you're a Texan, you're a UT alum, and you really love your community, family man, but also you're going to share some things that you're an expert in when it comes to the non-surgical ways to maybe take care of your eyes or your face.
Correct. Thank you so much. That's very kind. So you said what type of things I'll be talking about during the event. And, you know, I started my practice as an oculoplastic surgeon, which means I'm an eyelid expert. I do cancer, I do reconstruction, and a lot of my practice has become minimally invasive ways or newer ways to do sculpting or shaping of areas around the eyes or the brows or the under eye bags or the double chin or the jawline with newer technology that's safe and effective. So I've trained doctors across the country. When you and I first met, I just kind of started doing some of these treatments. And now fast forward almost a couple of years, I mean, I think that I've done the most in the country on a lot of these treatments. So it's really nice to share our results and our expertise, particularly with the treatments called AccuTite and FaceTite. That's what I've done a lot of. There's two newer treatments also we've added to our practice. One is called Elevate. Elevate really helps neck bands. We really didn't have a treatment that was non-surgical for the bands around the neck here. And so it's really nice that we can share that treatment. And the newest, most cool one, I think, is called Evoke. And Evoke is facial remodeling, which means it can remodel your skin and your tissue without cutting and without needles. Looks kind of like a headset, and it can tighten the lines here and pull this back with no cutting or no injections, and additionally tighten the area underneath the chin in a similar fashion. And really there's no downtime. It feels like a hot rock massage, which everybody who's come in during this social distancing time loves, because they haven't been able to do things like get a massage or get self-care. So it's really been a nice treatment. And plus that treatment allows for social distancing in the office. So the patient can come in, they can get their treatment done, and the doctor or the nurse can step away and let them get their treatment.
Why is it when you talk about that, we start kind of standing up and touching our faces? Now, do you have the Evoke headset to show how it truly is contactless?
I do. So here's the first headset here. It's looks like headphones, and it goes right around the cheeks here. And so you kind of put it on the patient. It sits right on the fullness area of their cheek, and it works for about 45 minutes, and it heats the tissue from the skin, the tissue in between there, which is kind of like fat and some muscle, and it tightens the entire tissue, not just on the outside, but all the way down to 4 millimeters or deeper. And that really improves that area called the SMAS, or the fibroseptal network, that can pull and tighten that tissue as if you were getting kind of like a facelift type treatment. Now, certainly it's not going to be surgery where you're going to see a facelift, but a lot of patients don't want that anymore. They want that low downtime, middle of the road procedure. You do one treatment every week for about 4 weeks. It takes about 30 to 45 minutes. And then you see results in about 2 to 3 months, and essentially they're permanent. They last forever, which is really nice. Now, when I say permanent, I mean, I think it turns the clock back and will continue to age, but it really slows down aging quite a bit. So that's the first part of the Evoke treatment. And the other one here is for the double chin, or the area underneath the chin.
Okay.
And this part just goes right here like that. And again, there's a little strap like that that you can put your chin underneath. And it's really cool because the same thing, again, you just kind of place this chin strap underneath your chin. You can focus it very specifically right underneath the chin. And what's really cool about this technology is it uses artificial intelligence. So 1,000 times per second, they're going to be looking at different parts of your skin that need the treatment, and it tightens it, and it's safe, and it's really customized by the patient. So my chin versus your chin, not all chins are created equal. Some people want just a little bit of skin tightening, and some people want fat melting. You can program it based on the temperature. It's amazing.
Boy, I definitely want to try that. Let's talk a little bit about how the pandemic, the shutdown, the concerns about just being healthy and not getting the coronavirus. How has that changed your industry?
It's been quite remarkable. I mean, I think elective surgery is a key part of what we do, or outpatient surgery. And so when we had a shortage of PPE back in March and April, and we had to stop things slowly, or kind of quickly, abruptly, everything stopped, we had to really transition to thinking about how we can continue to do treatments without using PPE. But we really, for the sake of the unknown, everything else, we essentially shut down operations except for emergencies only. And then in May, as we slowly began to open back up safely, we had screening protocols in place. We still do that as well before surgery. So we're trying to make sure we do our best to contain the spread of this unusual virus as much as possible. Patients, though, have kind of been split. Some patients feel like they have a lot of downtime. They want to get procedures done. And so we just really adhere to our medical board and CDC guidelines as much as possible to see what's safe and not safe to do. But more and more people are more in tune with their face because they're on the video a lot more. They're video
Because they're
chatting
doing
their
this.
because they're doing this. So Zoom and FaceTime and Skype and those different platforms that we have, you kind of look at yourself in a different way than you did before. I've had so many patients say, oh, my eyes look heavier, or I look sleepy, or this area really bothers me, or there's not a filter that I can do to fix that. How do you help me fix that more permanently? So, it's my job to walk them through their options, give them different options. And then when they come into the practice in Austin, we can kind of see what best fits their needs. And a lot of people are interested in the area. Obviously, financially, there's a big range on what you can do and can't do. And so I think it's nice for us to provide that range. It's almost a full service from skincare all the way to surgery.
And one thing that I want to say is thank you for, during the stay-at-home order, that you were very innovative in that you did a lot of social media, a lot of live streaming with other professionals to answer questions about the virus or answer questions about what people wanted to know. And so I commend you for that, really thinking outside of the box. And I learned a lot it seemed like every night I was walking my dog and listening.
Yeah, we did an Instagram live basically every night for about three to 4 weeks. And a lot of the speakers will be featured at the event. We all were kind of in it together. We didn't have the ability to go to conferences and connect with one another. Our event had just been postponed at that point. So everybody was kind of already excited to do that. But it really opened up raw emotions and feelings about what was really going on. And, a lot of us are also practice owners. And so that's the entrepreneurship side of this event. And there's real tough decisions that come with all of that. So it's nice to have that camaraderie. It was also nice to connect with patients and physician colleagues and nurse colleagues and everyone else that tuned in to kind of see how everybody was doing. It made the world feel a little bit smaller. I think a lot of us felt a little bit of burnout after doing that quite a bit after some time, but it's still a nice way to connect with people, see how one another are doing. And what was very interesting for me personally was seeing how different parts of the country were either opening or closing, and it wasn't all the same everywhere. So I think you would see a certain wave of emotions in, California, and then you would see them in Texas a few weeks later, and then maybe Florida a couple weeks after that. But by the end of the day, I think as physicians, we want to educate, we want to share good information, and we miss seeing patients. And so it's a nice way for us to connect with colleagues and connect with patients.
So for the folks who missed seeing those series of Facebook or Instagram lives, you've got ideaAUSTIN that is coming up in early August. So again, for anyone who is just tuning in right now, why should they be a part of this virtual event?
I think it's a great thing to get education. There's not a lot of times that the general public gets access to the world's experts on different topics, even if you know nothing about medical aesthetics. You're also going to hear from some of the industry amazing leaders when it comes to design and art and music as well. It's going to have that Austin vibe, but also still be education heavy. You're going to see demonstrations. You're going to see real life experiences from physicians who are doing the treatments, as well as some of the people who've received the treatments. You just want a fun environment. And most importantly, if you go to ideaAUSTIN.co, you can register, you can donate, you can give back to the Central Texas Food Bank. It's just really a community event. With all the negativity out there in different areas, it's really nice to see some positive people and some positive news together, and that's what we're trying to go for.
Well, I signed up, I've got my reservation ready to go, and I'm going to be part of it. So thank you for inviting me to be able to ask a few of the questions here and there. And can you mention about the headliner in addition to you?
Yeah, so we have Dr. Paul Nassif from Botched who's joining us. He's actually partnered with our practice to see patients in Texas starting next year. It was supposed to be a little bit sooner, but we've now kind of delayed that process due to COVID-19. So we're so excited that he's joining us. He's very passionate about helping those who can't get food for themselves right now. So the Central Texas Food Bank is a great partner for us with this. We're just really lucky to have him as well. And our other big name person that we have, in addition to all the 30 plus speakers that we have that are amazing, is Sonia Richards-Ross, who's in Austin. She's a 4-time Olympic gold medalist, and she's a University of Texas Longhorn, and she is going to be amazing. She's going to talk to us about her story about athletics and beauty. And so it's really nice to see her side of how, being an athlete and being on TV, and then also having to present a certain way whenever you're sometimes at your most indisposed when you're trying to win a race, how she can share that story. And also about her new phase in life, where she's also a TV host on Fox's Central Avenue TV, and she's also running her own foundation as well. So it's good to kind of connect those people. She and I have been friends for a long time. It's just so nice to reconnect with her and really reach out, because we're both Central Texans in different parts of the Austin area, and it's just good to connect for a great cause.
Anything else that you want to add about ideaAUSTIN that we haven't talked about?
Yeah, I just think this is a great opportunity for you to learn and get educated in a very low intensity environment. You can watch from the comfort of your own phone or your computer, and it's going to be fun. It's a good break from everything else that's going on. Even if you're out on the boat or you're at home or you're mowing the lawn, just tune in and we'll just learn something.
Fantastic. Again, August 8th, we are ready for ideaAUSTIN. Thank you, Dr. Paul.